Hi, everybody. This is Patty Purcell coming to you with Hunger Solutions New York, and we are super excited to be sharing this webinar with you today. This is an opportunity for more Head Start and early Head Start families to learn about how to enroll in WIC and SNAP. So we hope that you have some of your staff listening to this so you can be well versed in what you will need to know to help your families access these amazing benefits that are there for them. So I'm going to turn this over to Misha Marvel, who works at the Hunger Solutions New York, providing information and education services to the WIC agencies and so forth. And she will introduce herself a little better than I just did, and we'll get going. So thanks for joining.
Sure. Thank you so much, Patty. I am very excited to work together more and to connect more Head Start and early Head Start families with all of the nutrition benefits and programs that they're eligible for. I remember we were both very surprised to see that only 50% of Head Start families were in WIC, and I think it was 46% of Head Start families participated in SNAP last year. Is that right, Patty?
Yes, I think that is correct. So we know that there are so many more families that could have the opportunity to take advantage of these benefits.
Yep, and we know also some people mistakenly believe that you can only participate in one or the other, and that's not true. You could participate in both if you're eligible for both. And so we just hope that this webinar is just the start of a very successful partnership to work with Head Start families and get all the nutrition benefits that they're eligible for. I'm going to switch my slides here, and hopefully it progressed. And I'm going to go ahead and turn off my camera so I'm not juggling several things at the same time. Hopefully you'll still be able to hear me just fine. And before I jump in too much further, I should introduce our organization for those who are listening who might not be familiar with us. Hunger Solutions New York is a statewide nonprofit anti-hunger organization. We focus on the USDA's federal nutrition assistance programs, including SNAP, WIC, school meals, summer meals, the child and adult care food program, which I know you're all familiar with, and most recently, Pandemic-EBT. We raise awareness of these programs and work to maximize participation among all who are eligible, among all age groups. For example, we manage community outreach programs across the state to provide direct client assistance at the local level. We serve as a program resource for individuals, organizations, and agencies, and we promote federal, state, and local policies that contribute to ending hunger. And those of us who are involved with outreach know that people may need to hear and see and read things multiple times from multiple trusted messengers before they reach out and connect with nutrition programs. And so we're just so very grateful that you and other Head Start and early Head Start staff may well be the trusted messenger that helps a family access the food that they need. While I know none of you needs to be convinced of the crucial importance of food security, know that the consequences of food insecurity among children are well documented and include many direct connections to learning and health outcomes that are foundational to the success of our students as they age and go through their school years. This chart is taken from a white paper from the National Anti-Hunger Organization called the Food Research and Action Center. They reviewed the latest research on the harmful impacts of poverty, food insecurity, and poor nutrition on the health and well-being of children, adults, and older adults. And as you may know, in adults with food insecurity, rates of diseases like depression, diabetes, hypertension, and high cholesterol, as well as generally being in poor or fair health, are much higher. And I've kept the older adult category here because we know many more family members older than age 60 are now caring for their grandchildren or great-grandchildren even, and their health impacts the family too. And so among children, food insecurity is associated with higher odds of having asthma, anemia, and fair or poor health. And it's associated with a higher risk of cognitive issues, aggression, anxiety, depression, behavior problems, even suicide ideation among older kids, and hospitalization. This chart might be familiar to you. It shows what's called the social determinants of health. They are the conditions in which people are born, grow, live, work, and age. And they include factors like socioeconomic status, education, neighborhood, and physical environment, employment, and social support networks, as well as access to healthcare. And the determinant of food relates to a person's access to food, including healthy food options. Addressing social determinants of health is not only important for improving overall health, but also for reducing health disparities that are often rooted in social and economic disadvantages. And a health in all policies is an approach that incorporates health considerations into decision-making across sectors and policy areas, and is something that we were really pleased to learn that New York State has begun to include and address across state agencies. We have a lot of programs in our state that improve the health outcomes of food insecurity for people of all ages, but because of who you are, I'm going to focus on just a few of the child nutrition programs, as Patty mentioned, especially SNAP and WIC. And include a little bit on older adults for those families where grandparents are taking care of grandkids, or there's multiple generations in a household. The challenge is that all of those programs are underused even before the pandemic. And that's really a part of why we are recording this webinar. While the reality of food insecurity has always been unacceptable, the increased need amid COVID-19 really highlights the importance of making sure we reach all eligible families. The USDA programs that protect kids against hunger include WIC, SNAP, summer meals, school meal programs, and child and after school meals. These are not all of the USDA nutrition assistance programs, but besides WIC, they are the entitlement programs, meaning that everyone who qualifies and applies may receive benefits. And WIC has been fully funded for many years, so there's no waiting list. Why am I focusing on WIC? Because of who you are and who WIC serves and who WIC is not serving at the moment, and WIC's proven benefits. Some of you who are listening may be experts in WIC, but for those who are not, just wanted to remind everyone that proper nutrition is vital at all phases of life, especially before birth and through a child's 5th birthday. And obesity in childhood can begin before a child is born. Gestational diabetes, excess maternal weight gain during pregnancy, and high birth weight can all increase a child's risk for becoming obese. And WIC helps reduce these risks by promoting healthy eating and providing nutrition education for pregnant women and children younger than 5. And WIC's focus is improving access to fresh and nutritious foods in the communities where participants live. And participation in WIC is linked to better overall dietary quality, increased families eating more fruit and vegetables, and reducing how much sugar that they eat. And this is also why I'm highlighting WIC today. Even before COVID-19, many eligible people were not participating, especially pregnant women and children ages 3 and 4. We are really hoping that more Head Starts will strengthen their partnerships with their local WIC clinics to ensure that more kids and families will benefit from WIC services. And next I want to show you the coverage rate for WIC in our state and how it's changed the past several years. This is the coverage rate for 2014. It was prepared by the State Department of Health. And in counties that are shaded green, more than 50% of eligible households were participating in WIC. Yellow shows between 41 to 50%. Orange is a little worse, from 31 to 40%, and red is the worst at less than 30% of eligible households participating. So just keep an eye on your county or region and see how it changes over time. 2015, 2016, 2017, 2018, 2019. So you can see we have some work to do. The vast majority of the state has changed more to orange and red, which is the lowest participation. And this is also just as a reality check this is the most recent data we have, and it's from 2019. And so we know that the need has risen and the potential participation rate has increased since COVID. Overall, statewide, in 2019, the Department of Health, the State Department of Health estimated that WIC's coverage rate was 43.5%. Again, that's statewide. And we can see that the vast majority of counties actually had less than 40% participation among eligible pregnant and postpartum women, infants, and children. And we know that the need has risen in recent months. Most recent participation from the Department of Health has not seen a significant increase in enrollment since the pandemic started. The participation has improved somewhat thanks to the remote services option, where New Yorkers in most places can apply and receive nutrition education over the phone, and they can send in their documents electronically. But we are really looking to and hoping that community-based organizations and partners can help spread the word about WIC services and the remote services option, so that more families know that they don't have to go into their local WIC clinic and they can receive benefits and services from the safety of their home. Again, some of you might be experts in WIC and are well aware of what I'm going to share over the next few slides, but I'm asking you, please don't tune me out. I'm sharing these things because community partners like you already working with eligible families have told us time and time again over the last few years that they did not know the points and the benefits of WIC that I'm going to share with you right now. And they did not know that WIC was so underused. We all need to do a better job consistently and repeatedly sharing these benefits and improvements in WIC so that families really know what they are missing out on if they choose not to participate. For example, of these benefits of WIC, I want to note that many people have an impression of WIC as primarily a formula program, not realizing that WIC supports breastfeeding. So who's eligible for WIC? Someone may be eligible for WIC if they are pregnant, if they are a mom of a baby that is up to 6 months old, a mom of a breastfeeding baby up to 12 months old, or a child under the age of 5. And of these eligible groups, I want to repeat what I said earlier. Pregnant women and children ages 3 and 4 had the lowest participation and coverage rates among the possible participants. To get WIC, the mom and or the child must simply live in New York State and have income below a certain amount, which is 185% of poverty, or get benefits from SNAP, Medicaid, or TANF. And a person's immigration status is not asked or considered at any point in the WIC program or WIC application process. So the public charge rule, if any of you are familiar with public charge at all, does not apply for WIC families. But still, this has been a great concern for communities over the last couple of years. Something else that might not be well known is that dads and grandparents and foster parents and caregivers can apply for WIC on behalf of the children in their care. And this slide shows a photo of an eWIC card. If you are familiar with the WIC program from before the last year and a half or two, this is some really good news about WIC. You may have heard that in the past, WIC food benefits were received on a check and a family, a paper check, and a family had to buy everything on their food list all at once. That is not the case anymore. The eWIC card acts just like a debit card that is swiped at the register. Families can shop when it works best for them, and they can shop all at once for their WIC benefits, or they can go back to the store as many times as they need to until they use all of their benefits by just the end of their 30-day WIC cycle, their benefit cycle. And due to the pandemic, as I mentioned earlier, many local WIC clinics are allowed to provide services remotely over the phone or on video chat, and they are loading the eWIC cards remotely as well. And this is a huge benefit to families during these months ahead. Another great and popular new benefit of eWIC is the WIC to Go app that can be downloaded to WIC participants' phones. WIC to Go will show their benefit balance, show a list of approved foods, let participants scan the barcode or the UPC code to see if a food is WIC approved, find a WIC clinic, find a store that accepts eWIC, and it can even hold a participant's next WIC appointment. The WIC to Go app is being built up and improved even further in the months to come, but what we have here is what is currently available for WIC participants. Those of us who are not WIC participants can also download the WIC to Go app, and there are a number of resources and reasons that we as community-based organizations and partners could use the WIC program as well to, for example, help to find a store that accepts eWIC, find a WIC clinic, and also a number of other resources and breastfeeding supports. As we are able, we encourage you to use some of the outreach materials that speak to all of these benefits to help lead families to their local WIC clinics. In the WICHelpNY.org Resource Center, there are a growing number of different outreach pieces and fact sheets, including several in Spanish, for your use as you see best. And the website in general, or hungersolutionsny.org website, including these pages, are actually available now in 10 languages, including English. And again, we want to encourage you to reach out to your local WIC clinics and create or strengthen a partnership with them. And we are happy to help facilitate that connection. If you aren't familiar, all of the WIC clinics in your area, WICHelpNY.org website, the main page to that includes a link to local WIC clinics, and I also have it here. Next, I'm going to jump from WIC and I'm going to move on to SNAP and talk a little bit about SNAP, because as we mentioned when we first started, Patty and I were both surprised to learn that less than half of Head Start families participated in SNAP last year. So just to level set everyone, SNAP is our country's largest anti-hunger program, and it helps mostly working families, senior citizens, and people with significant disabilities feed their families. SNAP issues electronic benefits that can be used like cash to purchase food at grocery stores, farmers markets, and other retailers. And families who use SNAP and WIC to buy food can spend their money on other household items they need for their family. It's important to note that for every meal provided by food pantries across the country, SNAP provides 9 meals. And there's just simply no way that the emergency food provider network can make up this gap of 1 meal to every 9 SNAP meals. SNAP works as it's intended to. It expands and contracts as the economy does, and millions of people across the country were added to the program after the pandemic began, including now over 250,000 New Yorkers. The technology worked and they quickly got benefits, and the monthly benefit amount increased from $139 per person in February of this year to $210 in June. And I should look up the very most recent information. We have a couple more months after that. But again, the program expands and contracts as people's income does as well. We consider participation in SNAP as a sort of a protective vaccine. And specifically, there's a growing body of research that shows how SNAP can safeguard against food insecurity and improve the health and academic and employment outcomes for growing kids. Eligibility and benefit levels are based on household size, income, and other factors. And I included this slide so you can get a sense of the average monthly benefit for different demographic groups. For example, the average benefit amount for households with older adults was $168, whereas the average benefit for households with children was $382. The U.S. Department of Agriculture and New York State recognize that many people may need some extra help completing the application for SNAP benefits. NOEP, the Nutrition Outreach and Education Program, is a nationally recognized SNAP outreach and education program and is in place in most counties and all boroughs in New York State, the green counties here. Services are provided by local NOEP coordinators who are employed by community-based organizations, and we hope that you are already connected with your local NOEP coordinator, but just in case, I'll share a little bit about their services. NOEP's primary focus is to increase participation of eligible New Yorkers in SNAP. Coordinators provide both community education and client education and application assistance. And so NOEP coordinators can present information to your staff about SNAP benefits, and also it can serve as a referral resource for your families. Here's a list of what NOEP coordinators can do. Their services that are always free and confidential include pre-screening, helping applicants gather documents, fill out and submit a SNAP application. They offer translation services, and before the pandemic, many older adults benefited from in-person, in-home appointments or meeting with a NOEP coordinator at a public location convenient for them. NOEP coordinators can work to make sure that applicants get the benefit that they are fully entitled to, not just the minimum benefit. When you visit foodhelpny.org, you just click on your county and your local NOEP coordinators' contact information, their phone number, their email, their name, their address will all pop up there for you. Hunger Solutions New York also has a targeted SNAP outreach project on Long Island. For this project, we've developed a user-friendly online pre-screening tool that allows families to learn if they may be eligible for SNAP in just 8 questions. Households that pre-screen as potentially eligible, they receive remote assistance with the SNAP application process. Anyone across the state can use the eligibility tool, and that's available on our website. An outreach toolkit with materials that encourage families on Long Island to use the online SNAP pre-screening tool is going to be launched in early December. And the outreach toolkit will include social media posts and website buttons and flyers. And if any of you listening, if any Head Start on Long Island is interested in learning more about this project and receiving an outreach toolkit, please reach out to Kara Williams, listed here. Again, SNAP can be an intimidating and complicated process for some people. And I understand that Head Start staff, you may be used to seeing income guidelines based on a yearly estimate, but I'm showing monthly income here because SNAP eligibility is based on a person's most recent monthly income. And then most people are certified for up to a year. But again, eligibility and benefit amounts for SNAP vary based on household size and income and expenses and other factors. SNAP has special eligibility rules for households with a person over the age of 60 or a person who is disabled. And some of those rules may actually increase a household's monthly benefit amount. But again, the NOEP coordinators in your community are experts in these rules, and they can help pre-screen people and then help them navigate the SNAP application process. We've developed an outreach toolkit to help schools and community partners across the state spread the word about SNAP. We have a flyer and social media posts and graphics, all of which can be easily lifted and used through whatever way you communicate with your families. And for those of you who are embedded, I understand sometimes Head Starts are embedded in a public school building. Just also invite and ask if you would also please share these materials with your school administrators. And I want to make sure Head Start families know that if they lose food bought with SNAP benefits due to any reason, such as storms or flooding or power outages, they may be eligible for replacement SNAP benefits. The link here goes to our website and has information about the process for requesting SNAP replacement benefits. And we'll have that in the slide deck as well. I've talked a lot about our youngest New Yorkers. I'm going to pivot to the other end of the age spectrum. New York State provides SNAP benefits to more older adults than any other state. And yet we know that hundreds of thousands of New Yorkers who are age 60 and older may be eligible and not yet getting benefits. And we hear a variety of common barriers and misunderstandings that prevent seniors from participating. And just a few that we've heard are, people know about the program, but they don't think they're eligible. They have this mistaken belief of that they're taking it from other people. Like, if I use these benefits, someone else who's more needy won't get them. Many seniors, they also wrongly believe that they can't use other nutrition assistance programs if they're on SNAP or vice versa. Eligibility for other nutrition assistance programs is not affected by SNAP participation, and many seniors need and should access more than one nutrition program. Ironically, SNAP connects older adults to other popular benefit programs such as LIHEAP, health programs, and senior farmers market coupons. New York State has one of the highest senior populations in the country, and we will continue to outpace most other states in growth of older adults. For example, there are now more older New Yorkers, 3.2 million, more than the entire population of 21 other states. And many older adults face some significant hardship. In New York State, almost 1 in 10 seniors face hunger. And we know that compared to other adult age groups, seniors are particularly vulnerable to the health consequences of food insecurity. And households that include grandchildren are almost 3 times as likely to be food insecure than other households. New York State is a national leader around using SNAP at farmers markets. Close to 400 markets now participate. And the SNAP to Market website has a lot of resources, including farmers market locator and videos helping to answer frequently asked questions. The $2 coupon Fresh Connect checks are given for every $5 in SNAP used. New York started this program in about 10 years ago in 2011. as part of the overall Fresh Connect program, with the goal of increasing access to farm fresh foods in communities that traditionally don't have that access. And it's now available, the Fresh Connect program is now available at many seasonal and year-round markets. Similar incentive programs are available across the state, and if you're interested, you can learn more from the report the New York State Health Foundation published last year. It's linked here. And finally, there's also the Senior Farmers Market Nutrition Program. Seniors age 60 and older who have incomes below 185% of poverty. Seniors love this program, and many more would be eligible for SNAP as well. And the Farmers Market Nutrition Program is also a benefit for WIC participants as well. Summer seems a really long time ago, but it's never a bad time to talk about summer meals. The Summer Food Service Program, or what we just call summer meals, is our nation's program that provides healthy meals and snacks to children ages 1 through 18 when school is out for the summer. And these meals are served at locations where kids learn and play across the state. The success of summer meals relies on local sponsors who administer the program and serve meals at community sites. In the summer of 2019, 380 sponsors across the state were approved to serve meals at almost 3,000 sites. And we are so grateful for their work. And for those, if those of you who are watching who are maybe involved with helping with outreach for summer meals, we thank you so very much. I'm sharing about summer meals because there's a significant room for growth in summer meals in New York, even before the pandemic. When we compare the number of kids who eat free or reduced price lunch during the school year to those who eat summer meals, we're only reaching 1 in 4 low-income kids over the summer. And outside of New York City, that number drops even further to fewer than 1 in 6. We see especially pronounced gaps in access to summer breakfast and to all types of summer meals in the latter half of August, when many summer meal programs close. And that gap leaves kids in most areas of the state without access to meals for nearly 3 weeks before school starts back up again. Of course, this past spring, many schools and summer meal sponsors serve meals during unanticipated school closures, ensuring that kids had access to healthy food throughout COVID-19. In many areas, sponsors continue to provide meals through the summer, making really good use of child nutrition program waivers that USDA allowed, grab and go meals, and other flexibilities. And we are really grateful for their work. We do invite you to take a look at this report, the Summer Food Service Program Status Report, that's linked on our website, and hope that this information can help inform local conversations and efforts to close the gaps in future summers. And even though we're late into the fall, it's right before Thanksgiving. It's really never too early to think about next year, even though we don't know what next summer is going to look like. If your Head Start might be interested in serving as a summer meal site or helping to recruit new sites in underserved areas, or to be in conversation with summer food sponsors in your area, there are some helpful resources available on the summermealsny.org website. The USDA's Capacity Builder Map provides a whole lot of information, including determining whether an area is eligible to offer summer meals. Another program, Summer Meals is a program where sites have to be located in areas where at least half, 50%, half or more of the kids qualify for free or reduced price school meals. Though this past summer, some locations were able to get that requirement waived. And we would be hoping that if needs arise that may happen again this next year. So please check back summermealsny.org over the fall and winter for updated information. I think I had mentioned before, summer meal sites operate under sponsoring organizations that manage the program at the local level. And to make it easy for new sites to get started, we publish a sponsor directory every year. If you're interested in becoming a site or helping to recruit sites or to be part of the conversation, as I mentioned, please feel free to use the directory to connect with sponsors near you. And partners, of course, we hope Head Starts would be partners to help with outreach to ensure all the families that you serve know where to find meal sites near them. For example, next summer or late next spring, your schools could share information with families and have flyers or social media or however you would communicate with your families. We would very much appreciate that. The last program I'm going to talk about is Pandemic-EBT. It's a brand new crisis response program, and it provided, or actually is still providing, $420 in food benefits to 2.1 million students across the state. This includes all children who received free or reduced price school meals through the National School Lunch Program, and includes children attending public, private, parochial, and charter schools, and 3- and 4-year-old children attending universal pre-K. And so if your Head Starts are connected in any way with those 3s and 4s who may also attend a universal pre-K, some of those kids would have been eligible for this program. How and when children received Pandemic-EBT benefits was dependent on how they were certified for the free or reduced price school meals. In addition to these key messages, I want to stress that immigration status is not a consideration for Pandemic-EBT, just like for WIC. P-EBT is directly connected to school meals. Both school lunch and breakfast and P-EBT are available regardless of immigration status. They're not considered part of a public charge test. And this also means that P-EBT does not affect a parent or a guardian or a child's immigration status. Also, P-EBT did not replace or change any other affect any other nutrition program. So all families who received P-EBT should use it. And but everyone has already received the benefits. So why am I mentioning it? I'm mentioning it for 2 reasons. One is that we know that many families who received Pandemic-EBT because of their child receiving Medicaid have not yet activated their card to be able to use it and redeem those $420 in groceries. So they have the benefits on their Medicaid card, but they have not yet called to activate the card for that. And then second, we do expect a new round for this 2020-2021 school year. So please visit this website for updates and outreach materials as information becomes available. I've gone over a lot of information in our short time together. You may be wondering, like, what can I do? It's really simple. We just ask that you consider connecting with the resources that can easily help your families and share even just a little of what you learned today with both your colleagues and families that you serve, and encourage them to connect with these programs as well. And while I could say much more about all of these programs, I'll leave it there and encourage you to please visit these websites to learn more about any of them. And again, I'll share the slide deck with Patty so she can share it out and you can easily visit the links I embedded throughout. And then of course, you can always connect with us directly. I've included my email address on this slide, along with a link to sign up for our email alerts, which we send when there are program or policy updates or outreach opportunities or any other newsworthy item related to the federal nutrition programs. We're also very active on Facebook and Twitter and Instagram with resources that you can easily reshare on your channels if your Head Starts and early Head Starts are active on social media as well. And thank you so much, Patty, for letting me share this information, and for everyone who's watching, and for all that you do to support your community. And I hope you consider us as partners in your most critical work.
That is wonderful. Thank you so much. I think that was such a lot of information that will really help some of the programs that maybe have had new staff start and people who are not that familiar with how to go about all of this. And I know there have been some obstacles in the past where families have had challenges with staying current with WIC and so forth. And so I think the materials that you presented today really help highlight how some of those obstacles have been removed. And it's like there's a joke going around, sort of like, this ain't your grandma's WIC, you know, like this is modern and electronic and much easier to use in the store. And so we do hope that even if people have an impression of WIC from years ago, that they will familiarize themselves with this new information, share it with their families at the Head Start and early Head Start programs on a regular basis, so that, you know, people who are ready to receive the information at that moment in their lives will hear it and be able to take action. It's free money for food, and we want to make sure that our kids, our Head Start families, are getting every dime that they are entitled to. So this is part of what our job is to help educate those who don't know or don't have access or think something differently than what is actually the case now in our society. So making certain that everybody who needs the information has it and can make their own decisions, well-informed decisions with all of the information.
Right.
So this is extremely valuable. We've been talking about doing this for years because of the rate, the low rates of Head Start and early Head Start uptake of WIC and SNAP. So this is a long time coming. I do so much appreciate Misha's time. She's been working on this with me for quite some time, and I'm so excited. And we are only an email away from any questions. And so we know this is a recorded webinar, but please don't be shy. Please send Misha your questions around SNAP and WIC and other hunger solutions questions. I know she mentioned there's free materials if you need handouts or posters. So be sure to ask about that and visit the website to see what's new. So thanks again, and we'll see y'all again soon.
Thank you again. Thank you, Patty. Take good care.
Thank you.
Right. Bye.
Bye.